Australia 2026. On the surface, we are the picture of health, a nation of athletes, surfers, and outdoor enthusiasts. But the data tells a different story. This year, cancer diagnoses in Australia are reaching record highs. While our survival rates are among the best globally, the sheer volume of new cases is a growing national crisis. Before we dive into the why, a quick note. The following information is for educational and documentary purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The primary driver of our increasing rates isn't a mystery, it's math. Australians are living longer than ever before, since cancer is essentially a disease of accumulated genetic mutations over time. An aging population means more opportunities for those copying errors to occur. In 2026, the baby boomer generation is reaching the peak age for cancer incidence. But there's another factor. We are looking closer. Australia has some of the most advanced screening programs in the world. From the National Bowel Cancer Screening Program to the newly expanded lung cancer screening launched in 2025. We are catching cancers that would have gone undetected a decade ago. We aren't necessarily more sick, we are just more aware. However, there is a shift that aging doesn't explain. We are seeing a global and local spike in early onset cancers diagnoses in people under the age of 50. In Australia, colorectal cancer is now the leading cause of cancer death in people aged 25 to 44. Researchers are pointing toward the modern Australian lifestyle. The transition from whole foods to highly processed Western diets is altering our gut microbiomes. We're seeing evidence that specific bacteria, fueled by high sugar and low fiber diets, may be directly damaging the DNA in our colon walls. This, combined with sedentary lifestyles and the highest per capita alcohol consumption in several regions, is creating a perfect storm for younger generations. Then there is our environment. Australia remains the world capital of skin cancer. Despite decades of public health campaigns, our proximity to the hole in the ozone layer and our culture of sun-seeking means melanoma continues to lead the charts. Beyond the sun, the big three, obesity, alcohol, and smoking, vaping remain the leading preventable causes. Obesity is now linked to 13 different types of cancer, including breast and pancreatic, even as smoking rates hit record lows in 2026. The long-term effects of previous decades and the new uncertainty of long-term vaping keep the respiratory cancer rates high. So, where do we go from here? While the numbers are increasing, so is our hope. In 2026, we are entering the era of precision oncology. We are no longer just treating lung cancer or breast cancer. We are treating a patient's specific genetic profile. Immunotherapy is turning one's terminal diagnoses into manageable chronic conditions. The surge in cases is a challenge to our healthcare system, but the surge in survival is a testament to our science. We are a nation in transition, learning that while we may not be able to stop every diagnosis, we are getting closer every day to ensuring that cancer is no longer the end of the story. Remember, early detection saves lives. If you have concerns about your health, consult a medical professional immediately.